Good evening. I'm very happy to close this very interesting meeting and to share with you our experience about the management of a particular case of retinal artery macroaneurysm. RAMs are focal acquired dilation of retinal arterial branches that can classify as hemorrhagic or exudative. They range from 100 to 250 micrometers and more often found in temporal retina. While visual prognosis is generally good, complications can occur, such as macular edema and arterial occlusions from thrombosis or hemorrhage due to rupture of the aneurysm. Currently, there aren't approved guidelines for the management of RAMs. Most of cases spontaneously resolved, so they can be only observed. But complicated RAMs had to be treated with moderate intensity laser photocoagulation or even surgery when the bleeding is severe or the macroaneurysm is too large to be treated with laser. Cases with hemorrhage, submacular hemorrhage, can be treated with pneumatic displacement of the clots with or without tissue plasminogen activator. In case of premacular hemorrhage, YAG laser is used to perform a posterior iridectomy to consent to the passage of the disease in the vitreous to faster clearance. Recent study show some good results using anti-VEGF. But my case is particular. Is a female. She was 67 years old, and she was affected by hypertension and dyslipidemia. She reported a previous surgery for a cerebral aneurysm. And she referred to our clinic for a visual impairment. And fundus examination, we saw an outpocketing of arterial wall, and fluorescein angiography confirmed our suspect. We saw a pulsating around pooling of the dye with filling in saccular aneurysm. And spectral domino CT, performed at the time of our first access, revealed the presence of macular edema. In this case, transpupillary thermotherapy was performed, visual acuity improved, macular edema resolved, and only a scar persisted. But after almost 1 year, the patient returned to our attention for a new visual impairment in the same eye. And fundus examination, you can see a hemorrhage and some exudate. In the same artery proximal to the laser scar. Fluorescein angiography confirmed the presence of a new RAM. In this case, we can perform the swept source OCT that allows a precise demarcation of external and internal border of the wall, intra and subretinal fluids, and hyperreflective spots corresponding to exudate. EMFAS OCT and OCTA demonstrated the presence, clearly demonstrated the presence of the macroaneurysm in this section and in this one. In this case, the lesion was too closer to macula to perform TTT, so we performed the laser photocoagulation, focal green laser photocoagulation, but the threshold laser was not efficiency because the necrosis, coagulative necrosis, did not occur. And so we thought to an alternative, and we thought to verteporfin photodynamic therapy. It is a non-thermal photobiochemical procedure that offers a site-specific vascular occlusion with little damage of the neural structure surrounding. Verteporfin, as you know, is a lipoprotein that presents a good affinity, an high affinity for low-dense lipoprotein receptors that are upregulated in neovascular membrane in age-related macular degeneration. There are many case study that demonstrates the efficacy of the PDT not only in the choroidal lesion but also in the retinal ones. Here's one. This is a paper in which 6 eyes of 5 patients affected by retinal capillary hemangioma was treated with PDT. After the treatment, in all cases, you observe tumor regression or stabilization, as well improvement in subretinal fluid and lipid exudation. So these findings suggests us to try PDT in our case. So we performed a standard fluencies for PDT. And this is the results. Visual impairment, visual acuity improved, the hemorrhage disappeared, but the lipids exudation increased. And at web source OCT, you can see a complete obliteration of the aneurysm. This is the OCT angiography before the PDT. You can see very well the lesion, but after PDT, you can see a complete obliteration of the macroaneurysm. And in the choriocapillaries, you can see the difference of outcome of TTT and PDT. In fact, we have a less damage of the choriocapillaries layer. So, in conclusion, I would like to underline 3 important aspects. First of all, web source OCT is a rapid, non-invasive, high-resolution modality to visualize RAMs and their effect of surrounding tissue. OCT angiography show in detail the limits of the RAM, even in presence of a rupture and hemorrhage without injection of the dye. And the PDT could be an effective and safe alternative to treatment for ruptured RAM near the macula. Thank you.